So hello, I'm Marieke van der Putten. I'm a PhD student here at the University of Glasgow working in the Imaging Concepts group. My talk is about deep tissue in vivo oximetry using multispectral imaging. My project is kind of a collaboration between the Imaging Concepts group and also the Institute for Infection, Immunity and Inflammation. And I'm also presenting a little bit of work that we've been doing in collaboration with the Professor Ken Smith's group in the Department of Neuroinflammation in UCL. So just a brief outline, I'm just going to talk about the motivation for the project, which is oximetry of vessels supplying tendons. I'm going to talk about the image acquisition methods and the analysis techniques that I've used. So the algorithm that we've used for oximetry is basically based on the algorithm that Javier described earlier. I'm going to talk about extending this technique towards minimally invasive oximetry. And as I said, I'll talk about our collaboration with UCL. So rheumatoid arthritis is the motivation for this, my PhD project. And so it's an autoimmune disease causing painful swelling and inflammation of tendons and joints. It's quite prevalent. In later stages of the disease, joints can be irrevocably damaged. So there's unfortunately no known cure, but remission is possible with earlier diagnosis. It improves treatment options and improves the prognosis for the patient. However, it is difficult to diagnose at early stages. There's no single diagnostic test. Basically, a patient presents to a doctor with a certain number of symptoms, and once they have a certain number of symptoms, they'll be given the diagnosis. But it is very difficult to diagnose at an early stage. But we do know that there is a link between hypoxia and rheumatoid arthritis, as with many inflammatory diseases. However, the role that hypoxia plays in early stages of the disease and in the progression of the disease is not yet fully understood, and that's sort of the motivation for us looking into oximetry in tendons and joints, which are affected by rheumatoid arthritis. So the aim of my project is to develop a minimally invasive in vivo medical imaging system. When I say minimally invasive, I'm referring to microendoscopic probes, which I'll describe a little bit later on, combined with a standard multispectral imaging system for oximetry, and looking at blood vessels in tendons and joints. And for this study, we'll be using mouse models of rheumatoid arthritis and seeing whether we can detect hypoxia in early stages of the disease and monitor how it changes as the disease progresses and see if we can learn anything about that. So I basically started with the development of the custom multispectral imaging system. The vessels that I have been looking at in tendons and joints in mice are quite small, so it's a microcirculation in the tendon tissue. So for reasons I'll go into in a minute, we use the blue wavelengths for that. And so at the moment I'm just attempting to demonstrate in vivo oximetry invasively, so surgically exposing the joint, the tendon, before incorporating probes. So this is just sort of a diagram of the imaging system as it is at the moment. For our illumination, we use a supercontinuum laser, which is a white light broadband source, and it's in conjunction with what's known as an acousto-optic tunable filter, and that basically selects the wavelength of choice. They're sequentially acquired by the camera. We use 6 wavelengths in the blue. I just want to briefly talk about the objective that we use. We use what's known as a reflective objective, and as opposed to a conventional objective lens that you will have seen in a lot of microscopes, this actually just consists of mirrors. So if you have collimated light entering, you get 2 reflections, and you have illumination coming to focus at the focal plane. The reason for choosing this initially was to minimize chromatic aberration. However, I decided to use it to generate annular illumination for the purposes of this imaging system. So if you have divergent light incident on this objective, you actually get this focal point offset from the focal plane of the objective, and this gives you this sort of illumination pattern. And so this is basically the shadow of the light on the primary mirror. These are the spokes, how it's actually held. And so if you set up the optics right, you can, what I have done is basically have the annulus surround the field of view, so just surrounding the field of view. The reason for doing this was so that we could eliminate back reflection and also to simplify the analysis. So basically we can then assume that light traversing any blood vessels we're imaging will have undergone mostly just single pass absorption. So yeah, just to show you this graph of the extinction coefficients of using deoxyhemoglobin, whereas a lot of retinal oximetry is done in mid-500s. For these smaller vessels, we've used a range of wavelengths between 410 and 450 microns, so this is just the output of the tunable filter that we use. So this is an example of a transmission profile of light through a 10 micron diameter vessel for varying oxygen saturations. So we basically can see that even at such small vessels, we can distinguish between different oxygen saturations using these wavelengths. So the oximetry algorithm, I won't go into much detail about this as Javier described it earlier, but it is a calibration-free oximetry algorithm and based on the retinal oximetry work. However, I do make some assumptions, simplifying assumptions due to the differences in optics of the imaging systems. So we basically have a model describing light propagation through a vessel. We generate theoretical transmission profiles at each wavelength. We also have this parameter which was talked about earlier to account for decreases in contrast. So we can account for local variations in tissue thickness. So for example, if you're looking at a blood vessel in a tendon, you won't necessarily know the thickness of tissue above the blood vessel. So then this is just applied to the experimental data and to generate a lot of these parameters such as oxygen saturation. So basically to first illustrate that we can distinguish, or we can image blood vessels and detect changes in oxygen saturation in actual tissue. I used ex vivo mouse tendons, and we know that in ex vivo tissue, blood vessels will be deoxygenated due to localized metabolism of oxygen by cells post-mortem, unless it's exposed directly to air, in which case you have diffusion of oxygen into the blood vessels. So what I did was I took a mouse leg, put it in a chamber through which nitrogen was flowing. So we took images at this point, assuming that it will be deoxygenated, and stopped the nitrogen flow, allowed the vessels, superficial vessels, to reoxygenate, and we wanted to see that we could measure the increase in oxygenation, and that's exactly what we saw, which was just two examples. Basically just demonstrates the sensitivity of the imaging system to oxygen saturation using this imaging system and using these wavelengths. So once I'd done that, I started working on the in vivo work, so looking at oxygen levels in tendons in living mice. As you can see, this is quite invasive, but I'll talk about that in a minute. The mice were anesthetized using an injectable anesthesia and the tendon exposed. And as for reasons I've just basically mentioned with the ex vivo work, there is a need to control diffusion when you expose vessels like this. So for that, I've basically just been using cling film, like a plastic type film. And even through that, you still get relatively good images. I do take several sequences of images at each wavelength and then average over them to help with signal to noise. So I should have put a scale bar in here, but the field of view of this image is about 200 microns. So these vessels are quite small, and as you can see, for example, absorption is higher at 410. So we have higher contrast at that wavelength. So this is still work in progress. I'm currently attempting to image a cohort of healthier control mice and using first an inflammatory model and then a model for rheumatoid arthritis. So hopefully results will be coming soon. But once that's done and the proof of concept in vivo is performed, I'm hoping to basically add these microendoscopes. So this basically allows the imaging system to be minimally invasive. So microendoscopes, the ones that we have are about 1 centimeter long half a millimeter in outer diameter. It's a triplet of gradient refractive index lenses, and they basically act as an optical relay between deep within tissue and the objective lens. So the aim of using these is that we can do longitudinal studies with mice such that we can monitor the oxygen levels in the same mouse as the disease progresses. The issue with these microendoscopes is that because you have several interfaces, there is a lot of chance for specular reflection of light, loss of light through the probe. So I'm currently developing an illumination system whereby we have a series of multimode fibers adjacent to the microendoscope for illumination. Adjacent to this lens, and then so the illumination path will be adjacent, providing approximately angular illumination as I'm doing currently in vivo. And this will be encased in a hypodermic needle, the diameter of which will be approximately 1 millimeter, so still quite small. So that's basically where this project is hopefully going soon. And now also just to briefly talk about this collaboration we have been doing with the Department of Neuroinflammation at UCL, and this is oximetry of veins in the rat dorsal spinal cord. And this group previously shown that there's a correlation between basically a model of multiple sclerosis and hypoxia. This hypoxia was performed in bulk tissue, so we basically wanted to set out to perform this in a localized imaging sense of the actual veins in the rat dorsal spinal cord. So a similar system was used, a multispectral microscope using a white light source LED, an SLR camera and lens, with a liquid crystal tunable filter used. Because the scale of these vessels were bigger, they actually used wavelengths, longer wavelengths. So this is just an example of the acquired data set for control rat. So we looked at a set of control rats and a set of rats which have this model of multiple sclerosis. I'm just going to show. These are an example of the results we got from the control rats. So we have several stages of oxygenation. The first set of results here are control rats at breathing normoxia. Then they were increased to 100% oxygen, inspired oxygen, back to normoxia, and then to increasing stages of hypoxia. So as you can see, in these results were provided using this calibration-free oximetry algorithm. So for the purposes of this application, it seems to be quite promising that we can see the increases of oxygen and decreases as expected. So looking at the average results for all the control rats, and this is a model of the multiple sclerosis. The diseased rats are hypoxic in these veins, supplying the dorsal spinal cord, when compared to the control rats. And these preliminary results actually support the previous findings, whereas now we have localized information of the actual veins themselves. I should just point out that these are the error bars on this graph are the standard deviations of all of the individual rats. There was a spread of oxygen levels in individual rats. So to conclude, we've demonstrated the applicability of the retinal oximetry algorithm, so beyond the retina. Currently investigating hypoxia in mouse models of rheumatoid arthritis, and we have conducted an analysis of veins in the rat dorsal spinal cord models of multiple sclerosis. So the next step is to develop this minimally invasive system to carry out longitudinal studies of oxygen saturation in rheumatoid arthritis. The kind of overall ideal end goal would be to, if it was successful, to be able to use it as a diagnostic tool for susceptible humans. But we'll see what happens with that. But thank you.